So how do we diagnose the peripheral neuropathy? Well, often we'll use an electromyography or an EMG nerve conduction study. Now there are little filaments, you can test sensation on the bottom of the foot in different little clinical ways to do it. But I like to do this because it will rule in or rule out a nerve compression in the spine for me. It'll rule in or rule out an entrapment or compression neuropathy like I talked about, and it'll tell me if there's a primary muscle problem or a primary nerve problem, and it'll tell me if there's a true sensory motor neuropathy. So these things give us a lot of information. And what I look for is a diminished waveform. There's different little technical things to look for in these, and you need to be able to work closely with the person that's doing the study for you, which we are able to do that. But remember, a nerve conduction study is going to be normal in up to 40% of people early in the disease. It's just not going to be picked up. And if you have just small fiber neuropathy, it's never going to be picked up by one of these studies. So you have to know when to look for that and when to incorporate a skin biopsy. So you have to have a good study. You got to be able to interpret it, which we can. And then other things we do is blood work to look for fundamental underlying causes. Like what if somebody just has a simple deficiency of B12? Well, that's easy peasy to fix, right? You just give them an IV infusion of B12 periodically, or injections or a supplement, and then they're better. What if their A1C is double digits or worse? Well, then you know you got to get that under control. What if they have a spike in their serum protein? Well, you got to get that under control. What if they have low protein? Well, you know their nutrition status is depleted. So we look at all of these to try to find the fundamental reason that somebody might have this neuropathy, and we try to address those reasons while we also address the symptoms.